Hello everyone. Today I have brought a new topic which is known as the TPN, that is total parental nutrition, जो कि आपकी clinicals में बहुत use आएगा. So many times people have seen TPN which is hanging in the gastro wards, and you will be very much curious कि as a first year of graduation कि what exactly is. So in today's class I will be telling you. So let us see. So total parental nutrition would look like this, something as a milky form. So total parental nutrition usually have three components. You should be very much clear about it. First is the carbohydrate component, which is plain, and carbohydrate component why we need, because 70 to 80% of energy is gained from the carbohydrate. So one component is the carbohydrate. So next is the lipid. Lipid is very important. That is also your fat part. So this is also important as a giving energy to your body. So in a patient with a lipid, when we are giving a TPN, we should be very much clear, since it is made from a soya bean, that whether the patient is having any kind of allergy to it or not. So we have to pre-confirm giving this TPN. So one is carbohydrate, second is lipid, and third is your amino acid, that is known as your amino acid, which is known as your protein part. So when these three components are separated before giving the patient and is kept in the refrigerator. So if a patient arises to you and you have to give a TPN, make sure you take out the TPN 1 hour before and then you give it to the patient. So it has to be mixed. So many times you will see such procedure. Nursing officer might be mixing these three components, and then the final mixture will be looking like this, as a whole milky color. So the question which arises is, what is exactly TPN and why we need TPN? So total parental nutrition, the patients who are not able to take orally, but the energy has to be given in somehow. So in that cases, we go for the TPN, that is total parental nutrition. Always remember, in the TPN, we should not add any further medications and all. So TPN is somehow, it is a hypototic solution. So it cannot be given periphery. We need to use a central line as an SS to giving this total parental nutrition. So the patients who are not able to take orally, or the patients who are chronic ill, and for them the energy has to be given, it will be given by our TPN. So it is a kind of hypertonic solution, as I have already told you, and to require for the normal metabolism, tissue maintenance and repair and energy. So why we need, I have already told you, in case of patient is having a severe burn, patient is NPU, and patient is acute renal failure, multiple fractures are there, tumor of the GI, and all those cases we have to give TPN to the patient. So in this picture you can see this patient is getting TPN from the central line. Okay, the subclavian vein central line, and which all goes to your right atrium and all. Okay, so we can also use the periphery line, that is also known as PICC also. By that route we can give. So other methods you can see, we have nasogastric tube, we have gastrostomy tube, we have jejunostomy, we have all those tubes you might be seeing. Now once you have started your TPN, you should be very much careful. In the starting, you have to check the monitors every 10 minutes until half an hour. You have to be very much vigilant with the patient, whether the patient is having any kind of difficulty in breathing. So all those things monitoring has to be done. Okay. Now when the TPNs are going on, we should be very much clear that the patient might have many complications while patient might be getting TPN. The patient can have air embolism, patient can land up having your hyperglycemia or hypoglycemia, everything. So if in a patient, if it is planned to, we have to discontinue TPN, please do not discontinue the TPN suddenly, because patient will land up having hypoglycemia. So always remember, TPN has to be tapered off in the sense, if it is getting among some 10 drops per minute, so it has to be reduced to 5 drops. Suddenly the tapering should be, suddenly we should not ever stop the TPN. So in a nursing station, if a patient TPN is going on, you should be very much careful to prevent from the air embolism. The IV set rates of the TPN should not go fast. Patient will land up having hypervolemia also if the solution is going very much fast. Okay, so all those things we need when we are starting the TPN. This is how the back looks, the sterile gloves, everything. So we have to check the orders, doctor's orders, we have to check the physician's order, at which rate we have to give, what kind of TPN we have to give, and you have to take out the TPN 1 hour before, so as to prevent any kind of hypothermia or pain or vasospasm. We have to inspect the fluid, very important. We have to inspect the fluid because after mixing the TPN, it should not be in clouding nature. If it is clouding nature, there is a chance for the infection to the patient. Okay, and the sides should be very much clean. Okay, wash your hands. You should have a mask, everything sterile, gloves. It should be very sterile procedure. Okay, so and again one thing I have to tell you, so I have already told you when you are tapping of a TPN, so be very much careful. And suddenly there's a question for you, if somebody asks you to stop the TPN or you don't have a TPN, always remember you have to keep ready the 10% dextrose, because if suddenly there it goes empty, patient will land up having hypoglycemia. To prevent that, 10% glucose can be given. So daily laboratory tests in these patients, we have to check the glucose, because since it's a high calorie or high glucose level, so the patient can have a hypoglycemia. We have to monitor blood glucose level frequently, and all those magnesium level, BUN level, we have to check for the patient. So I have already told you it should be tapered out of. There can be sepsis, there can be electrolyte imbalance. Electrolyte imbalance in the sense that TPN may provide magnesium and phosphorus and all. So patient will have electrolyte imbalance regarding to TPN. Okay, there can be hyperglycemia, as I already told you. There can be hypoglycemia also. So we have to keep 10% glucose ready. Hypervolemia, if the rate you are not seeing to it, being very much careful, there can be a chance for hypoglycemia. There can be hepatic dysfunction also because of the concentration, okay, of fat relative to proteins and all. So this was for the today's session. I hope so you have got some knowledge about the TPN. Thank you so much.